นี่จะเริ่มเนี่ยไม่ได้เอางี้ไหมเดี๋ยวเอาลำโพงนี้คู่นี้อันนี้ดังกว่าเพราะงั้นที่มันเป็นลำนี้ติดสปีกเกอร์น้ำมิ้วปิดเสียงใช่ไหมพวกเราใช้ไมค์แต่นี้ไมค์นี้ปิดแล้วโอเคลองดูว่ามันก็ยังเอ็กโคอยู่ต่อให้ได้แล้วเราจะเริ่มใน2 นาที 2 วิให้ได้เต็มเดี๋ยวนี้เลย
Hi Tim, just to let you know that we are now opening the webinar, so the event is now live, and we have around 300 participants joining.
ขอโทษแต่ว่าหมอทำกับตัวว่าได้ยังเริ่มแล้วหรือจะเสียบหูไหมคะง่ายกว่าไหมคะ
Welcome everyone to this side event that's part of the 7th Committee for Disaster Risk Reduction. We have quite a lot of participants here from around the world, which is wonderful to see. We're just having a minor technical glitch with the moderator's speaker. It should be resolved in a minute. If it's not resolved, then we'll proceed and then hand over to the moderator when it gets resolved. But just wanted to welcome everyone. I see we have a lot of good welcomes from everyone from Australia, Philippines, as far away as Fiji, a few people from Fiji, which is wonderful, and Dominica. Well, okay, right. That's wonderful, in Bangladesh. So we're looking very much forward to this. And if you have any questions, you can put them in the questions and answers chat box. So we'll just give it one more minute and then we'll start. Thanks.
Okay. Can everyone hear me? I think so.
Yes. Thanks, Dr. Chu. We'll hand over to you. Thanks. Yep.
Okay. Good morning, everyone. We would like to welcome everyone to the event today, the side event of UNDRR on the risk communication for better disaster risk management. We have several speakers today, so after everyone gives the remark, we will do the panel discussion. It's more like Q&A session, but we will also have some kind of brief discussion on these topics, which I think will be very interesting for everyone. So first, let me introduce myself. My name is Kiratikon Naksompoplau. I am an editor-in-chief for Thai PBS World. It is an English language news service of the Thai PBS, and I'll be the moderator today. You can call me Tulip for short. Before we start, I would like to take note that all attendees are muted by default. So if you have a question you would like to ask, please submit it through the Q&A feature, not in a chat box. And if you agree with the question, you can vote it up and it will be on the priority. And then at the end of this webinar, in the Q&A session, we will select a few of these questions to direct to the panelists. And now I would like to officially welcome you all virtually to this side event. And I am very much appreciated that you taking the time and look forward to this fruitful conversation. So first of all, I would like to invite Mr. Nathapanu Nopakun, the Deputy Director General of the Thailand Ministry of Foreign Affairs, to deliver his introductory remarks.
Yes, thank you. Mr. Timothy Wilcox, Program Management Officer and Officer in Charge of the Regional Office for Asia and Pacific, UN Office for Disaster Risk Reduction, or UNDRR, distinguished panelists, ladies and gentlemen. I am very honored to join this event and deliver these introductory remarks. While the world is facing multi-hazard risks exacerbated by climate change and devastating disasters, we have seen rapid technological progress in the field of information and communication technology, or ICT, in the last decades. With such technology, information and data is widely accessible and can be transmitted faster among the public. A rapid communication system certainly benefits people as they can receive timely information, which in turn enhances people's awareness of the situation. On the other hand, misinformation can cause the public panic and distrust. Therefore, risk communication plays a critical role in strengthening disaster preparedness, enhancing risk management, and saving people's lives. As for the risk communication strategy, in response to the current pandemic in Thailand, a central communication unit was appointed under the Center for COVID Situation Administration, or the CCSA, as a key mechanism for communicating with the public. This team has worked closely on a daily basis with the Emergency Operations Center of the Ministry of Public Health to provide updated information on the situation and also to review the information prior to conveying the news to the public. This process has helped ensure more reliable information is provided, which led to the public's cooperation and compliance with the government measures. It has almost been 2 years already since we began this work amid the dynamic situation. I must say that this work is indeed challenging, but it has moved forward Thailand's effective response efforts as much as possible, despite the situation at hand. For more effective disaster risk management and public engagement on COVID-19 protection measures, risk communication strategies need to go beyond traditional approaches of sectors working in silos to include a whole of community approach. This inclusive approach will enable the community to better understand disaster risk, embrace new innovation, and build partnerships with all relevant sectors, such as media, civil society, and the private sector. Effective risk communication systems will help enhance individuals' preparedness so that they can make risk-informed decisions both before and during disasters. In strengthening risk management, risk communication should be integrated into all areas of disaster response and capacity building. All levels of engagement need to be strengthened. Distinguished participants, today's event is a good opportunity for us to exchange experiences and lessons learned from cross-sectoral collaboration about risk communication strategies so as to better manage future disaster risks as we build back from the COVID-19 pandemic. Key challenges and opportunities in strengthening risk communication throughout the disaster management cycle, particularly during compound and complex emergencies, will be explored. I therefore very much look forward to our discussions today. I would like to thank the Ministry of Public Health of Thailand and the UNDRR for their efforts in organizing this important session. My appreciation also goes to all the panelists for their valuable participation, especially during these critical times. And may I take this opportunity to pay tribute also to all the frontline workers around the world, especially those who work in the field in support of pandemic control and disaster management. I wish you all good health and well-being, and I wish this meeting every success. Thank you and Sawadee krap.
Thank you very much, Mr. Nopakun, for your remark. Now I would like to invite Mr. Timothy Wilcox, the Program Management Officer and Officer in charge of the Regional Office for Asia and the Pacific, UNDRR, or the United Nations Office for Disaster Risk Reduction, to deliver the remark.
Thanks very much, Kuntula. And Thank you, Mr. Natapanu Nopakun, the Deputy Director General of the Thailand Ministry of Foreign Affairs, and our distinguished guests and participants. And thank you very much for joining us for the side event on risk communication. We're very happy to be co-organising with the government of Thailand on the margins of the 7th session of the Committee on Disaster Risk Reduction. As we know, the importance of risk communication to early warning and early action in the context of sudden onset disasters is well established. And the ability to communicate hazard forecasts and risk information to vulnerable communities and stakeholders successfully is crucial for effective disaster preparedness and response in order to reduce the impact and also to prevent the loss of life. However, as disasters and risks grow more complex, it's becoming increasingly important to integrate risk communication to all aspects of disaster risk reduction, including the prevention and mitigation of slow onset or prolonged disasters. After all, across a variety of hazards that people face, risk communication and knowledge cannot trigger risk reduction action unless those risks are not only communicated, but also understood by all of the at-risk populations in a community. And effective risk communication is no different than any other communication that aims to encourage behavior change and preventative action. Indeed, we know that the principles of risk communication are consistent across disciplines, especially public health and disaster risk reduction, which is why we are very glad to have officials from both the health and the disaster management sectors here in today's panel. And this convergence of these two sectors became even clearer with the onset of COVID-19 pandemic last year. And indeed, in many countries, national disaster risk management agencies have played a key role in supporting risk communication efforts. Indeed, risk communication in the context of COVID-19 was also one of the key issues that we at the UNDRR addressed through one of our regional policy briefs last year, especially in the light of the emerging infodemic. And in fact, from these webinars, the recommendations that we had offered then still apply to today in the context of the pandemic and indeed disaster risk communication more generally. These include the need to understand your audience. And this is a key principle in communication. Content and means of communication need to be contextualized to the needs of different groups. This is particularly important not only to ensure the message is received and understood by the target audience, but also to trigger the needed response or behavior change. Also to bridge the last mile. This goes a step beyond understanding the audience to proactively reaching out to ensure that no one is left behind. It's especially important to reach groups such as the poor, the remote, the elderly, and persons with a disability, which may or may not have access to traditional media, social media, or information technology. The other one is building trust, which is for the public to act on messages. It's essential that the audience perceive the messenger is credible and trustworthy, and without contradictory or confusing messaging, which is what we've been seeing sometimes in some messaging around the world with COVID-19, as well as the need to counter misinformation. So misinformation and disinformation cannot be ignored. Given how fast and how far information can spread through social media, it's important that officials devote considerable time and energy to countering misinformation. But overall, we hope that today's session will help expand and build upon these points and concrete examples on how countries and groups can utilize risk communication to keep populations safe from all forms of hazard. And we particularly thank the government of Thailand for co-organizing this event with us, and thank SCAP for providing us with the opportunity as part of the 7th session on the Committee on Disaster Risk Reduction. And we wish you very well with this session, and please do ask as many questions as you like. Thank you very much, Kuntulit.
Thank you very much, Mr. Timothy Wilcox. And now I would like to invite the first speaker of today, Dr. Hasnina Binti Ibrahim, Public Health Specialist and Deputy Director of Pahang State, Ministry of Health, Malaysia. So we would like you to share with us the experiences and lessons in communicating with the different population groups in Malaysia during the pandemic. Now the screen is yours.
Thank you, Madam Moderator. Thank you, Mr. Natapanu, Deputy DG of Thailand Ministry of Foreign Affairs, Mr. Timothy, and the organizing committee. On behalf of Ministry of Health Malaysia, today I will share, actually the topic today will be on the good practices on risk communication during pandemic COVID-19 in Malaysia and evidence base. Next slide, please. Next slide, please. Okay, thank you. Since late 2019 up to date, COVID-19 has emerged as a significant public health threat to humankind around the globe, the so-called pandemic threat. It has caused a significant challenge to the healthcare services and the nation's economy, as well as causing considerable inconvenience to the public. Therefore, I would like to share here some of good practices which was evidence from our local studies in 2020 and this year. Among the study that will be highlighted here is the new norms. Do we Malaysians compliance to SOP on preventive measures of COVID-19 among Malaysian public? The aim is to identify the level of SOP's compliance to new norms practice, namely with 4 key findings. Number 1 is on the physical distancing, which is a main issue, which need urgent attention and action is needed to address to this issue. Behaviors such as having a close conversation and linger around together has become social norms and related to sense of belonging, especially in suburban areas. The second one is a small proportion of people not wearing face masks properly due to nature of work. And the third one, in Malaysia, we have a system to register everyone who enters any premise, which is called as MySejahtera. This study found out that the registration in MySejahtera is highly complied, especially at the premises where people are required to spend time, such as wet market, shopping mall, malls, and workshop, compared to food stall, petrol station, and convenience store. And the last one is about hand sanitizer, which was provided at the premises and was seen unutilized. And as compared to the other SOPs, for example, face mask, body temperature screening, and MySejahtera registration. What I would like to share here, this study involved about 4,105 respondents involved in quantitative survey and 83 locations involving 4 states, namely Kuala Lumpur, Selangor, Perak, and Negeri Sembilan. And the response rate are very good, 99.6% and 100% respectively of the study. So for the key challenges, next slide please. For the key challenges of enhancing risk communication, particularly in compliance to SOPs, is for the respondents to bear the cost of compliance. We have gathered some information such as there is chances of possibly lost income, possibly lost job, possibly unable to work effectively as normal due to COVID-19 SOPs, and due to COVID-19, it will also possibly make the respondents experience a negative impact on their social life. In addition to this, COVID-19 makes people, respondents feel angry, makes the respondents feel anxious and stressful. Another thing we discussed also here, what is about trust in science and media. The study found out only quarter, 27.5% actually completely trust the scientists with facts and figures. And only 13% completely trust the media involving newspaper, TV news, and news apps. Next slide, please. The opportunities as evidence in this study found out that there is ability among respondents to comply in order to maintain physical distancing from others, to take body temperature while entering premises, to wear face masks at the public area, and to wash hands frequently with soap and water or hand sanitizer. And during this pandemic, the respondents disagree to be in close proximity with people outside their house, disagree to take off their mask, face masks whenever they want, disagree to not washing their hands after touching any surfaces in public places, and as well as disagree to enter public premises without taking their body temperature. There is also an opportunity of enhancing risk communication when the respondents has an obligation to obey the law. They disagree about more than 80% to break the SOP, meaning that they disagree to break the SOPs. Last slide, please. So, lessons learned from this study, what we can conclude here, pandemic COVID-19 is still around us. It can infect any of us. It is invisible. We do not know who has the virus because most of them are asymptomatic, and there is always chances of these asymptomatic cases transmit the disease to any of us or vice versa. And to break the chain of infection, individuals must play a crucial role by adopting the recommended protective behavior, health behavior, strictly as outlined by Ministry of Health. Practicing the recommended preventive behavior measures of 3 Ws: wash frequently your hands with soap and water or hand sanitizer, wear face masks in public areas, or if symptomatic, and warn yourself and others to stay at home is good practice. Seeking treatment if developed symptoms, and also preventive measures of 3C, which is also to avoid crowded area, confined space, and close conversation. De-infection, COVID-19 can be kept in check to prevent further transmission and break the chain of COVID-19 transmission. And regardless of the high level of awareness by respondents in the survey, due to human tendency to need close interactions and need to follow the standard as portrayed norms practiced in society and have more inadequate control over it, it affects the practice of physical distancing. Therefore, enforcement of government on SOPs, particularly for physical distancing at public places, will enhance the adherence to this practice in the public. Although information cannot be fully controlled, better management can be applied to outbreak or pandemic situation via proper information dissemination. Hence, the role of social media is crucial to keep on updating the public with timely information, especially to the target population or subpopulation through a credible spokesperson, address empathy and allay speculation, as well as address and answers all impending questions. The impact of COVID-19 also has a role with vaccines. Vaccines on the pandemic will depend on several factors. These include the effectiveness of the vaccines, how quickly they are approved, manufactured, and also delivered to the countries, the possible development of other variants, as well as how many people get vaccinated. And this immunity helps us fight the virus if we are exposed. Getting vaccinated may also protect people around us, because if any individual is protected from getting infected from the disease, he or she is less likely to infect someone else. This is particularly important to protect people at increased risk for severe illnesses from COVID-19, such as healthcare providers, older or elderly adults, and people with other medical conditions. With this, I end my presentation. Thank you very much.
Thank you very much, Dr. Hasnina, for your remark. Now, I would like to invite Mr. Anthony Fritz. Mr. Anthony Fritz is a communications manager for New Zealand's National Emergency Management Agency. He has been working for communication response to multiple agencies since 2016. So it's very interesting from New Zealand that it has been praised around the world for its communication, the way it's communicated for its people. So we would like to hear your experience in communicating disaster risk and disaster responses messaging before and after disaster, and maybe give some example of good practices that other governments can learn from.
Thank you, Conchulip. Tēnā koutou katoa. That means greetings, everyone, in our native language of Te Reo Māori, and it's an absolute privilege to join such a distinguished panel. Now, I know that COVID-19 is the issue of the day, but I'm also going to talk about other natural disasters as well, and how we communicate risk about those. So the National Emergency Management Agency provides leadership over New Zealand's emergency management system, but we also have a key role in communicating risk in regards to earthquake and tsunami in particular, which New Zealand is particularly prone to. So I'm going to start off by walking you through how we communicate risk before, during, and after an emergency. And then I will talk about our response to COVID-19 as well. Next slide, please. So before an emergency, which is what we refer to, I guess, as peacetime, we see our role as really empowering communities so that rather than dreading a potential disaster, that they feel as prepared and empowered to respond to that as they can. So we have a public education program with a strong focus on earthquake and tsunami awareness. We have our Long or Strong Get Gone campaign, which which promotes the right actions to take in the event of a local source tsunami. So if people feel an earthquake that is long or strong, we tell them to get gone. We launched that after the very large Kaikoura earthquake in 2016, which generated a very unexpected local source tsunami. And we now have 9 out of 10 New Zealanders knowing the right actions to take. We also have New Zealand Shakeout, in which we invite people from around the country to drop, cover and hold, and to practice a tsunami evacuation. And last year we had over 680,000 participants join us in that, which we think is pretty good for a country of 5 million. And we also operate the getready.govt.nz website, which is a website that provides nice, easy and accessible information about preparedness, about what to do in an emergency. And we're about to translate that into multiple languages so that we're reaching a wide proportion of New Zealand's very diverse communities. Next slide, please. So where this work in peacetime comes to fruition is when we have an emergency. On the 5th of March of this year, we had not 1, not 2, but 3 tsunami in one morning, which I think is unprecedented. So how do we make sure that the public stays safe? That's where the public education is really important. We know that a lot of people self-evacuated because they knew the right actions to take through our Long or Strong Get Gone campaign, or from years of practice in their own communities. We have one really nice story. There is a small coastal township of Matata, which has about 700 people living in it, and it has a school of 80 people. And we chose to have our national shakeout drill there last year. So we based our campaign there, and at the time the 80 school kids, they were quite anxious about it. They were quite frightened, even though it was just a practice. And then a few months later, on March the 5th, they actually had to evacuate in a real life local source tsunami, and they felt much more empowered. They led the way, and they felt much more confident. And so it showed the value of actually giving it a go in peacetime actually made them feel more empowered when an actual emergency happened. And that was really gratifying to hear. So during this tsunami sequence, we pushed out information through multiple channels, because we've got a responsibility to make sure everyone in the country gets the message. So we use our national warning system, which pushes out messages to agencies and civil defence groups, as well as to the media. We use emergency mobile alert, which is cell broadcasting, to reach the public in geo-targeted area. We have a really close partnership with broadcast media in New Zealand, which is something we work on really hard in peacetime. And that means when an emergency happens, the media don't have to do a crash course in the middle of the night on the rather complicated processes of issuing tsunami warnings. They're ready to go, and we will do interview after interview to make sure we are getting the message out far and wide. And when we had 3 tsunami in one day, the storytelling ability of the media, their talent for that really helped get that message out, and to ensure people weren't too alarmed. We also, because we're a national agency, we don't have roots in every community. So that's where the Civil Defence Emergency Management Groups, so those are regional civil defence groups, there's 16 of them around the country, they will push out messages to their own communities through their own channels, because they know their communities, and that's a way to make sure that the farthest reaches of communities are getting those messages. Next slide, please. And so after an emergency, that's where things come full circle. We will basically draw up a list of the lessons we can learn so that we can do things better. on this occasion, we updated our Long or Strong Get Gone campaign to target those least likely to know the correct action to take, which included Māori, Pacific and Asian communities, as well as over 60s and low-income families. And those are the people who are often the most disproportionately affected by emergencies. And we've got a responsibility to make sure they're not left behind. So we developed a campaign directly targeting them, and we had that running on air as soon as possible after the event. Now, I will touch briefly on our response to COVID-19, which has obviously been quite successful. We are in lockdown at the moment as we have had a community outbreak. But some of the hallmarks of that campaign is we've had it's been a real collective effort. We've talked earlier today about the importance of building trust and having clear communication. I think this was one of the hallmarks of this campaign. It communicated an idea of collective action. It talked about the team of 5 million, which is New Zealand. It connected with diverse audiences with really targeted communications. It had a single source of truth. And one of the pictures you can see there is of our Prime Minister Jacinda Ardern with our Director General of Public Health, Ashley Bloomfield, fronting one of their regular media conferences, which have become a bit of a popular tradition in this country, and they held one just half an hour ago. And I understand it's still going. And the lady in the middle is a sign language interpreter, because again, it's just so important that we're getting those messages out to everyone in all formats. So that's been a real success so far, and we've still got a long way to go. Next slide. That's it from me. So thank you very much for your time, and I look forward to answering any questions later.
Thank you very much, Mr. Anthony Fritz. Then I would say the story from New Zealand, there's a lot of details and very interesting when you have 5 sequences of tsunami. I think it's a very unique situation for New Zealand. Next, we would like to invite Ms. Silma Desi from ASB Indonesia and Philippines. Ms. Desi was the head of Association of Indonesia Women with Disabilities and has also supported a project which focuses on making inclusive risk communication, targeting people with disabilities and other at-risk group. So it will be very interesting to see how you can make sure that the message gets sent across inclusively to all sectors of the society. Ms. Silma?
Okay, thank you, moderator. Good morning, ladies and gentlemen in this room. I would like to present some good practices and approaches for effective risk communication based on the experience of Lean On project. Lean On is the short version of Leaving No One Behind, the project that I worked on with ESB and Lean On Consortium in 2020. The project focuses on creating an appropriate approach for inclusive COVID risk communication by specifically targeting at-risk population. Next slide, please. Next slide, please. Okay, thank you. To ensure inclusivity in approaches, this project were guided by this key question. First, to what extent the at-risk population has access to inclusive COVID risk communication? Second, are each material focusing on COVID prevention protocol accessible and easy to be practiced by them? Third, are the feedback mechanism in place to report gaps in inclusive COVID-related information and public services? Fourth, to what extent the at-risk communities have access to inclusive social safety nets? And then the last but not the least, are the at-risk communities becoming part of the inclusive COVID response and risk mitigation? Next slide. Based on those guiding questions, the project developed these approaches. First, we establish inclusive and equal partnership with local organizations that focuses on the right of minority groups including people with disabilities. We then recruit, train, and empower volunteers from this local organization to conduct inclusive COVID prevention education and outreach. After completing the training, this volunteer conduct outreach to at-risk population about COVID risk, prevention protocol, and government safety net schemes. We also develop feedback mechanism so that the affected at-risk population can provide their feedback regarding the gaps in COVID-related information and public services. And lastly, we develop a network and partnership between these communities with the relevant stakeholder. In this case, the COVID established by the government from local to the national level. The government from these approaches led to the achievement of the project goal, which is to ensure that people with disabilities and the at-risk communities have access to equal protection against COVID through inclusive risk communication and social safety nets. Next, please. Next slide, please. Okay, thank you. I present some picture of our volunteers when they socialization and they meet with people with disabilities and minority groups and give some information for them. Okay, from the project implementation, we can draw some lesson on the good practice that we can carry forward. First, in the partnership and participant approach. We found that this approach is effective in ensuring inclusive, relevant contents and methods of communication. Second is the peer support approach. We found this approach enable the risk communication becoming more personal, where the information or her peers regarding the challenges and support that they need to mitigate the risk. And then third is ensuring the each media are accessible. At-risk communities have different needs and capacities regarding access to information. Ensuring your IC media are product and communicate in accessible manner will enable effective communication. Okay, next slide. Yep, thank you. We also found that risk communication consider the different needs and capacities in receiving and implementing those risk communication, enable the practical application of COVID prevention protocols, especially in supporting the behavior change among the at-risk communities. Further, we learned that establish communication and coordination between the at-risk communities with relevant stakeholders, such as the COVID task force, will influence the task force to develop inclusion strategies in their communication and services. And lastly, we found that identifying how far the social protection scheme can be accessed by at-risk communities and another way to ensure accountability, as we need to ensure that social protection programs benefit everyone's, including these communities. Next slide. Next slide, please. Okay, thank you. That's all my presentation for today. I hope this short presentation can provide some insight in creating the appropriate approach for effective risk communication targeting at-risk communities without leaving anyone behind. Thank you, everyone. Moderator, back to you.
Kunchula, Sorry, you're muted. Sorry.
Okay. Sorry. Okay, I would like to thank Ms. Silma Daisy. Like we can see the accessibility for is a very, very important factors in communications, and to make sure it's all inclusive to everyone, we have to ensure the accessibility of information and help and connect the related groups of people together. Next, I would like to invite Ms. Natalia Iliva, the head of Secretary General's Office of the Asia Broadcasting Union. Ms. Natalia is responsible for strategic development members, external relations and marketing. And media is another important role, important part of risk management, I would say. So maybe we can get some example, or Ms. Natalia can share some experience of the good practices of media, how to deal with government, how to deal with the society.
Thank you, Kirti Korn, and it's so lovely to see a moderator in this panel from our member, Thai PBS, and thank you all organizers for the opportunity to share ABU lessons learned. My introduction will be sort of more philosophical because we have 250 members and it wouldn't be fair to pick one, for example. The COVID experience actually showed that, like many other stakeholders, media houses and media professionals were spectacularly unprepared. And as usual, when disaster strikes, media was reactive following events. It wasn't proactive. It didn't have contingency plans for major health outbreaks, despite SARS in 2003 and MERS in 2013, which were two COVID viruses that jumped from animals to human, like it is suspected but not proven the COVID-19 did. However, media quickly found its foot. The pandemic highlighted the unparalleled reach of media to deliver timely, accurate, and understandable information, guidance, and advice, coming most importantly from one trusted authorized source. It also showed in a decisive way what we can do when all stakeholders work together, because the pandemic showed that media can work with politicians in a different mode, can link closely to scientists, and can reach all communities on the ground. Tim covered the main points for effective disaster communication, understand your audience, so you can tailor your message to different communities and build trust. So I will jump to the key lessons for media. The key lessons for media is to be proactive in disaster risk management and help building a national culture of prevention. I will echo in this respect the New Zealand practice highlighted by Mr. Anthony Fried. What they call peace doll, we call quiet time. We believe three key actions taken during the so-called quiet time between disasters will break the vicious disaster cycle, the silos between different stakeholders, and move us from a reactive response to systematic, all-stakeholder, proactive response of prevention to reduce risk altogether. The first two actions are related. This is educate broad audiences how to respond to emergency warnings. And second one, educate people how to minimize risk in their own environment. How to achieve that? COVID provided the answer in many countries during the pandemic. Broadcasters launched special education channels and programs to cover the school and university curriculums. So using media, we can open DRR knowledge transfer channels to combine the wisdom of all stakeholder groups and reach every segment of society, women, persons with disabilities, businesses. The third action is to have consistent efforts from all parties to link with media, especially public service media, so media can highlight their work to the general public. That is common sense. Media's reason for existence is covering life, everything of interest and in the interest to the general public. So in this sense, the media is the common denominator for the work of all other stakeholders. And it has to reflect in its programs what they're doing. This is how we can incorporate media in the chain of communication for early warnings and in policy development for disaster risk management. We have to use the COVID communication template we quickly developed and adapted for different hazards in advance, plan for it, not like before being reactive. This is not going to be easy because we need a change of mindsets on all sides, change of media-government relationship, change of media corporate culture, change of consumer behavior and habits. I'm highlighting this because we cannot separate now climate change mitigation and adaptation from disaster risk management. These are just the two sides of the same coin named building resilience. To build this culture of prevention through the media, we need to put substantial resources in journalist capacity building. The messenger is not ready. So in the quiet time, radio, TV, in digital outlets will work with all stakeholders, groups, science and technology, persons with disabilities. I want to highlight religious establishments, women groups, indigenous communities. And building this network is the key for saving lives and livelihoods. I would like to demonstrate how simple it could be and how effective it could be with one short video produced by our member NHK in Japan. Hope you enjoyed.
How many lives can be saved because of the evacuation zones?
自分の家の近くの避難先に逃げていただくってことをできる限りちょっと。
The high school team asked the residents to participate in an experiment. Yoshimitsu Tatara is 87 years old. His legs are weak, and he says he has given up evacuating. His closest evacuation site is the tsunami evacuation tower. But because he has only 2 minutes to reach the tower, he feels that he will not be able to make it on time. So the high school team suggests that he instead go to a 3-storied steel-framed building that is only 60 meters from his home. Will he be able to reach the new site within 2 minutes?
…津波が2分で来てしまうんですけど、50秒未満なので全然大丈夫です。クリアです。じゃあまだ命は大きい。これからいざとなった時はちょっと邪魔するかわかんないけど、よろしく頼みます。
Before this order-made evacuation, 195 people, half the number of residents living on the coast where Mr. Tatara lives, would have been caught up in the tsunami. The team added 26 new evacuation sites, all buildings with more than 3 floors. And as a result, 181 lives may be saved.
When I give example from Japan, people always tell me they're a very rich country, they can afford. But what I'm saying is not, you saw the example, it's not investing. It's just thinking ahead and being very committed to improve. Thank you.
Thank you, Ms. Natalie Oliva. I think the example you give from Japan is actually very interesting, how they utilize the existing resources they have. They didn't invest more, but they just have to work more. They just have to be informed and make it accessible to everyone. And I really like that they involve children, because in the process, all these students get to learn the risk management and risk communication as well. It's very, very good.
Yeah, and you link different stakeholders. You link youth groups, elder people, and media. Very simple.
Yes. Now, I would like to invite Dr. Rioma Cayano, who is Technical Officer on Health Emergencies at the World Health Organization's Kobe Center for Health Development. We are particularly interested to hear your view on strategies being adopted in Japan. I think Japan has a unique characteristic when it comes to social and norms of people in the society. Maybe there's something you can share us on that.
Thank you very much, Chair. So please let me share my screen first. Can you see this?
Yes.
Thank you. So I'd like to share with you our health perspective on the COVID-19 response, recovery, and preparedness. First of all, my working place, WHO Kobe Center, is located in Kobe, Japan, which was established as a symbol of the recovery from the Hanshin-Awaji earthquake 25 years ago. We are working on the research, global health research, especially in terms of the universal health coverage, and also the how to maintain the resilient health system in the context of emergency and disaster. That is called as a health emergency and disaster risk management as a concept to support the implementation of the center framework. And we, WHO Kobe Center, is the secretariat of the Global Research Network on this research concept, health emergency disaster risk management, and working together with more than 200 experts from all over the world. We are looking at 4 to 5 key research areas on this health EDRM. And for example, health data collection and management is a very important aspect on the how to manage the emergencies. And mental health and psychosocial support is also the key area to address in terms of the disaster and emergency. And this event's topic, health risk communication and also health risk literacy and identification and support for vulnerable population, also a very important area to address, and health workforce development to address all those key research areas. And especially in terms of COVID-19, community resilience and whole society approach are also a very important area. And currently, WHO Kobe Center is working together with the several universities in the world, the US, including USA and including Japan. We are working on the research project to identify factors affecting public health system resilience across multiple communities and countries in the context of the COVID-19. So although the study result is coming in a year or so, as far as we know, successful risk communication is a key for the successful disaster response. And health literacy is a key for this. And that is why we WHO have been advocating the importance of accurate knowledge and evidence-based action since the beginning of the pandemic. And simply, we have been advocating these 3 messages, 3B to manage COVID-19, be safe from coronavirus infection, be smart and inform yourself about it, be kind and support one another. So accurate knowledge on COVID-19 is very important to act appropriately, and be kind to each other is very important. And more comprehensively, this is the brief summary of WHO's actions since the beginning of the pandemic. All those actions, guidance, coordination, leadership, delivering knowledge and supplies, putting science and research at the heart of the pandemic response, or equal distribution of vaccine therapeutics. All those actions are important for successful preparedness, response, and recovery for this health emergency COVID pandemic. However, if the government, local municipality, community, or general population will respond appropriately or not, will be affected by the health literacy of each entity. So it is affecting this communication. So in this sense, Japan is one of the leading countries which experienced lots of disasters and emergencies. So I will highlight two things from Japan. Lessons from Japan for better health EDRM. And the first one is a resilient health system. So through the long history of responding to a lot of disasters, Japan has a very strong, resilient health system to respond to the health emergencies, disasters and emergencies. For example, Japan has the very comprehensive the medical team to address the health needs of the people affected by the disasters. And in the first 2 days and 1 week, what is called DMAT, Disaster Medical Assistance Team, is working on the rescue and support for the urgent, acute phase health needs for the people. And after that, other entities, medical team will work on the support of the people affected by the disasters, including the DPA, Disaster Psychiatry Assistance Team, and other the semi-acute phase health needs will be addressed by the Japan Medical Assistance Team. Those different entities will work on the different needs of health needs of the people. Then for the recovery phase, the mental health support center is working for the very long-term activity for the addressing people's health. Another lessons from Japan is Japan has a knowledge and experience of different issues during and after disasters. So this is very important to consider what to respond, what to address. Because if we don't have appropriate knowledge on what is a problem, so problem identification is very important to address those problems. But if you don't have enough experience and knowledge, you can't find it. In this sense, Japan has a long history, and also Great East Japan earthquake was a very big lesson for the Japanese people to understand what is a problem when evacuating from the disasters, such like the previous speaker showed in the video. For example, from the lessons from Great East Japan earthquake and post-Great East Japan earthquake disasters, several things we identified. For example, evacuation from earthquake and tsunami. There is an indirect death by deep vein thrombosis, lack of medicine, that can happen. So evacuation is not the end of the disaster response. So after evacuation, there will be a lot of problems caused by the evacuation itself. And also for the nuclear power plant accident, at a time, so many people, also including the people in the intensive care unit in the hospital, was forced to move out of the area 30 kilometers from the nuclear power plants. That evacuation itself caused a lot of deaths for the people in critical health status. That could also happen. So this is a lesson from the evacuation itself in the Great East Japan earthquake. And living other temporary houses, that is a good support for the people who lost the houses, but it causes the isolation of the people from or separating from the community or their neighborhood. That could worsen their non-communicable diseases, including the diabetes and also their dementia. Cognitive impairment also occurred. That should be also addressed. And through so many assessment and so many people came to the disaster area and asked people, what is the problem? What do you feel? That kind of the frequent assessment causes the assessment allergy for the people. So that causes the very poor engagement of people for the long-term follow-up. And also the high public and political awareness. So everybody look at the disaster area. So, and then everybody are interested in the TV shows on the disaster area. So that could also cause the generalization of the rare example. For example, the suicide in the living in the temporary houses. That was, if that problem is very small amount of small number, but it could be generalized by the kind of the TV shows or other media coverage. So that could also happen. So those are very different, very comprehensive lessons and experience of Japan could also affect the disaster response in the context of COVID-19. For example, what we should do is very simple, because COVID-19 response is requires people to do very simple 3 things: wearing masks, keeping distance, that is, and washing hands. Those 3 are the very key activities. That is very simple, but it is very difficult to be implemented in the context of the evacuation, in the context of different aspects of the social and cultural background. But if you have a knowledge, and if the government or local municipality or media raised people's awareness and also keep educating people appropriately, that problem will be mitigated. That is the very short remarks from input from me. Thank you very much.
Thank you very much, Dr. Oriol Matayano. Now we will go to Q&A session, and we'll select some questions that you sent in Q&A. The first one, we will just go very fast. The first one, it will be about the communication, because most of the time in the disaster event, or this natural disaster event or emergency event, the risk information flow tend to be one way, and most of the time communication infrastructure impact, internet might not work and it's not viable. How can we ensure the two-way communication from related agencies to the people at risk or people that getting impact? I would like the question to go to Dr. Hasnina from Malaysia first. Dr. Hasnina.
Yeah, thank you, Madam Moderator. That was one of the pending question actually, because of risk communication. It seems theoretically it is a two-way communication, but sometimes it happens in one-way communication. But the thing is, maybe I can address here is the importance of always listen to the public, or always listen to the affected population. For example, we have nowadays we have lots of social media platforms. For example, Facebook, Instagram, Twitter, and all that. You can have a direct communication with the affected population, where it can be a two-way communication, even though you are not facing face-to-face with them, but they are getting the information right from the horse mouth, where you can interact, whether timely or whether you can do some homework and get back to them. That is one of the things that you can have a two-way communication, whereby you can engage with them through the social media platform. Or else you can have with the community, like community in Malaysia, we have like COMBI, the Community for Behavioral Impact. We have teams with the from the public to engage with the public as well. We do COMBI with dengue, and also now we utilize COMBI with COVID-19, but we have to bear in mind that you cannot get together and not to be in a close situation. But then this is one of the platform that you can use at the ground level. That is one of the examples from Malaysia. Thank you.
Now, Mr. Fritz from New Zealand, maybe you can share with us too how to ensure two-way communication when the communication infrastructure is impacted.
Hello. So in New Zealand, we have what we call a devolved accountability system, which means at the national level, we may be in a bit of an ivory tower of sorts, working from the capital city, but the system is designed to cascade down to the local level. So that's why, for example, we have civil defence groups who will work directly with their communities on the ground. So while we may not have at the national level a dialogue with affected communities, there'll be volunteers on the ground. There'll be the local councils and civil defence groups who work closely with them. And of course, that's where using mechanisms like social media can be a really good way to identify whether there's any emerging risks or issues that you need to get on top of.
Thank you very much.
I think just one more thing. I think it is really important to use to work with community groups such as disability groups to make sure that you are reaching their communities as well, who you may not have a direct relationship with.
Yes,
Thank you.
that is a group that a little more complex to work with, I believe.
Yes.
Now, there is another question about involving celebrities in each country to help convey the message of risk communication. The question is, do you think involving this celebrity is helpful? And if yes, do you have instance from New Zealand where involvement of celebrities was really helpful?
Yes, we do use celebrities from time to time, but it's more than just celebrities. It's about community champions and leaders. For example, the Pacific community, they may not necessarily trust messages coming straight from the government, but they may trust a church leader or some other community leader. So people may trust a celebrity, but they may also trust someone else who's known to them. So it's about identifying people who the public trusts or that those communities trust. If that's a celebrity, then so be it, but it doesn't necessarily need to be one.
Yes. How about Ms. Silma Daisy? What do you think about involving celebrities in try to send out the message, make the information accessible to disability groups or marginalized groups?
Okay, thank you. There are two main challenges for the vulnerable population to access information. First, the information available from the government of other source and not accessible. Therefore, it is difficult for at-risk population to understand them. Second, the coverage of the prevention information is not reaching the remote areas or poor communities who have limited access to information. These are the main challenge for them getting access to the information.
Thank you. Now, I also want to hear from Ms. Natalia Iliva, being a media. Maybe you have different view on the celebrities of each country. Do you think having them help with the communication, it's working well? What is your thought about it?
It gives a big boost in persuading a lot of people that, for example, vaccination is the right thing to do.
Right.
I spent my, I was in Britain actually till a month ago, and there was one very popular DG, Joe Wiley, who has a sister who is with mental disability, and she's in a home with other people with mental disabilities. And Joe Wiley made such a big campaign through BBC that they actually jumped the queue for vaccination, because that was the big thing, the big problem there. And another example is that when the vaccination started, initial survey showed that people from Bangladeshi, Pakistani background, they were basically not taking vaccination at all. Then BBC did a huge outreach campaign through the 300 mosques in Britain to have the religious leader come in front and talk to people. And it turned the tide. It helps. Every single celebrity helps.
Yes. Well, we need all the help we can. Now, next question. It's the question about relationship with the media, from the government to the media for the disaster awareness communication. We would like to ask for any advice from getting their support in light of the other competing priorities, such as media has, as well as the pressure they face in monetizing their airtime. This question we would like to ask Dr. Rioma first. How do you force the relationship between your organization and the media to help convey the message?
Thank you very much for the question. For WHO is providing every day the media, how to say, the announcement and also media kind of lecture to the everyday by the Dr. Tedros, the Director General, as well as we use the different channel of social media, the YouTube channel and Twitter, Facebook, every possible measure we are using at the same time. So that maybe that was successful, and our follower got more than double from 2019 to 2020.
Okay, I would like to go back to Ms. Natalia about this, because we can see during the pandemic, some government actually issue emergency law that define some information as false information and use it as a fake news information. How do we as a media work around that to make sure that we get to share information to the public and not get caught into that kind of process?
I'll come back to what Tim was talking at the beginning. You have to know your audience, and obviously traditional, especially public service media, know their audiences because they have been with them for many years. And you have to build the trust. In the pandemic, the public service media had immense boost of trust. I mean, we have been dreaming about this for ages, and it happened. And it happened because of the two elements, that you know your audiences and you're broadcasting from from one trusted source. Because false, fake news, whatever they're called, they're just something that are rumors on social media. And many of our members actually set up special programs to debunk the rumors, especially when the vaccination started, because before that, I mean, people were trusted because the scientists were there, the experts were there, and they were saying so. The science also got a big boost in this COVID pandemic. But when it came to the vaccination, the conspiracy theories were immense. I'm just going to give you an example again from Britain. A lot of Muslim people didn't want to vaccinate because they were thinking, oh, that will affect pregnant women. The vaccination is not halal, and many other things. So the campaign that BBC did through all the mosques in the country was very effective, because the religious leaders are people they know, they trust, and follow their guidance.
Okay, thank you very much. And the next question, it's specifically about the disability. So what kind of mechanism in place to address the communication barriers to risk reduction faced by persons with disability? I believe this question will go straight to Ms. Daisy from the Association of Indonesia Women with Disabilities. Ms. Daisy? How do we address the communication barriers to risk reduction faced by the persons with disability? Okay, maybe we can also take this question to Dr. Hasnina in Malaysia, because Malaysia is also probably have marginalized group, and this of course will have the disabilities group and many kind of marginalized group in the country as well. Maybe Dr. Hasnina can share with us how to address the communication problems.
Yeah, thank you, Madam Moderator. Maybe what we can share here for the barrier, because in every channel of communication, there will always be barriers and noises that we have to identify, and we should address and handle it properly. So in order to handle this, for example, barrier with the example, if we have some remote population that we have to, or some the pockets of population that might miss our information, we actually have various channels of messages to be passed through, mainly from the social media, because nowadays I guess all of us have smartphones. Then that is number one. We go through all the channels, especially the social media. And if there is, for example, the barrier like with some remote groups or some subpopulation, we also can use, if they are working somewhere, we can use their employers to share the information, and then they can communicate the information with the employees. And sometimes we can use the association or NGOs, and NGOs also sometimes they are helping us doing sharing information with these groups. And sometimes in certain areas we can use the religious establishments and the religious groups to share the information. That is part of the things that we have been doing so far to address all the barriers in channels of communication. Thank you.
Thank you very much. Now we come to the last part of the event. Oh, hi, Miss Stacy.
Yes.
Okay. Yes, we would love to hear from you. How to address the risk communication with the disabilities.
Yeah, okay. We use different format based on the accessibility needs. For instance, for children, we use puzzle, sticker, and games for learning media. For other people, we use font and communication in local language. For people with disabilities, we have pantomime video, poster with picture, and song. The key is to always work through the peer support, because now what is the communication need of the at-risk communication communities. Okay, thank you.
How do you ensure that the message reach to the remote area though?
Bagaimana memastikan pesannya sampai ke daerah-daerah terpencil, Cil? Sorry, moderator, I'm just translating your question.
Okay.
Jawabannya apa, Cil? Bagaimana memastikan pesannya sampai ke daerah-daerah terpencil?
Kita melakukan kampanye secara langsung kepada masyarakat di daerah terpencil dengan peer support. Jadi teman-teman yang berada di daerah tersebut mewakili kelompoknya seperti itu. Jadi perwakilan itulah yang langsung terjun ke lapangan.
Okay, thank you. So the key is to work with the peer educators, because they're the ones who are exist on the ground, and they can reach the population who are often difficult to be accessed. So that's why it's very important to work through them. Thank you.
Okay, thank you very much. So now we come to the last part of today's event. We would like to ask each speaker to give us the final thought about the risk communication management. We'll go to Dr. Rioma Cayano first.
Thank you very much. The WHO has been providing a consistent message on the COVID-19 based on the science and research. So we truly want all entities, all different stakeholders support to work together to disseminate the right message, accurate message to the people of our world. Thank you.
Thank you. Now I would like to go to Ms. Natalia Iliva.
I cannot emphasize how much we have to be proactive, because nothing will work if we are not prepared, if we don't have our focal group in community, and if we don't have our plans.
Okay, thank you. Mr. Anthony Frith.
Hello, I think it's just build trust in the public, build trust in the media, and build trust in diverse disabled communities, and build trust in those communities who may not usually trust the government, because, you know, we're asking them to do something that they may not want to do, so they need to trust us. It's just so important.
Thank you very much. And Dr. Hasnina?
Yeah, I have a short message, but I have 5 things that we have to remember in risk communication. Number 1 is if you want to have a good risk communication, whether in disaster or crisis, number 1, you must have a risk communication plan, and also you must address all you must listen to the public what they need, and do not leave the vacuum in information. Once you sharing the information, you must be timely, and at the same time you must they must trust in you, especially when the government talk. People must have trust in government. And the last one is on transparent. Information should be transparent according to the country's need and according to the situation from time to time. Thank you.
Thank you. And Miss Daisy.
Yes, thank you. We have made a short video containing lesson and recommendation, which we will share in the chat.
Okay.
Yes, okay. But the key recommendation is please engage the representatives of at-risk groups since the strategic formulation through implementation and monitoring. From the strength working group that involve all stakeholders, not just the central and local government task force, but also NGOs, organization of people with disabilities, and other communities-based organization. This ensures the implementation of the whole of society approach as mandated in the Sendai framework for disaster risk reduction. Thanks.
Thank you. So from all the speakers, we can say that accessibility to information is very, very important. But once you have accessibility, you have to make sure that you have trust from the public as well. And you have to plan in advance. You have to make sure there are two-way communication and everything is transparent. That it also go back to building trust to the public. And you have to make sure that it's inclusive. You have to involve everyone, every stakeholders in the society. That also come back in circle, building trust and accessibility and communications. Okay, thank you very much. There are a lot of questions. There is a lot of questions today, but we are unable to go through all of them. There were like almost 50 questions, but hopefully everybody enjoyed the session and get the new information one way or another. So we would like to end this session, but we would like to remind all the delegates that the adoption of the agenda of the 7th session of the Committee on Disaster Risk Reduction will be held this afternoon at 2 p.m., 1400 hours. Please follow the Kudo link provided for the session. And have a good day, everyone. Thank you.
Thank you, Madam Chair. Thank you.
Thank you, everyone.
Thank you.
Thank you very much.
Thank you, everyone.
Thank you.
Goodbye.
Bye. Goodbye.
Bye.
Stay safe.
Bye.